Hi, my name is Connor McMullen, and today I'll be giving you a speech on why marijuana should be legal across all 50 states. Do you have chronic pain or medically treatable disease and are tired of taking lab-made pills? Well, there's this great natural remedy that people have used for thousands of years, but for some reason, it is still illegal in 21 states. Marijuana should be legal across all 50 states for a multitude of reasons, including those of health and money benefits. Here's why the plant should be legal. Health and safety are great concerns when legalizing marijuana, but there also has to be a great consideration on the way that it will increase the money flow through the country. Legalizing marijuana would increase tax revenue for state funding and save money being spent on keeping people in prison. This would benefit largely to different places in the state where the money is needed, such as road work and schools. For example, for the first 2 months Colorado has had legal recreational marijuana, it raised $6 million in state tax revenue. Washington also collected $120 million in the beginning of the 2018 fiscal earning year. Nearly half of all marijuana revenues fiscal 2015, 2016, 2017, 2018 went to the Basic Health Plan Trust account. That account is described by the Office of Financial Management as providing necessary basic health care services to working persons and others who lack coverage at a cost that does not create a barrier to utilization. It costs on average around $31,000 to keep a person in prison for a year. When decriminalized, the burden that is this country's prison situation will be eased. This will save taxpayers money and allow them to spend it on other goods and services that generate tax revenue, which also feeds back into the government. Marijuana also has a good promise for medical health benefits. It is said to be a wonderful muscle relaxer, and as some people with Parkinson's disease say, that it lessens the tremors and also significantly decreases seizures. It is clearly safer than opiates for pain relievers, as there has been around 42,000 overdose deaths on opiates compared to 0 for marijuana. Marijuana is non-addicting and certainly is much more natural than lab-made pharmaceuticals when dealing with chronic pain. If alcohol and cigarettes are legal, then marijuana should also be legal. There has never been a marijuana overdose. There's roughly 480,000 deaths yearly attributed to smoking cigarettes, though. And also, there's another 88,000 people a year that die due to alcohol, but there has never been an overdose death to marijuana yet. There's a lot of focus on why marijuana is bad for you, when the silent killer is really the sodas and junk foods that overrun this country. On average, there are around 300,000 people who die because of obesity each year. Marijuana is considered a Schedule I drug compared to heroin. That is also a Schedule I drug. Some other drugs in the Schedule II, not as bad as Schedule I, are cocaine, meth, and oxycodone. There are far more dangerous things that are legal already in the United States rather than marijuana. This is why it should be legal across all 50 states. Now that my speech has come to a close, I would like to remind my audience to always think with an open mind. Peace.